Bismillahirrahmanirrahim. So dear student, today we are going to talk about another chapter, Rhythmical Excitation of the Earth. In this chapter, we will discuss different things regarding the Earth, especially impulses produced in the SA node and transmission of these impulses through different part of the Earth. First of all, please subscribe our channel so that you may get good videos for you. So here I am going to discuss self-excitation of SA node fibers. Okay, first of all, SA node is present on slightly dorsal lateral side of the Earth and especially posterior side of the Earth. Okay, it has a specific characteristic which is that of self-excitation. Its ability of self-excitation means that it becomes excited. Depolarization and depolarization is occurring in this SA node. Second, what is the diameter? What is the length, and what is the width? It is about 3 millimeter wide, it is about 15 millimeter long, and about 1 millimeter. It is 1 millimeter thickness. Okay, it is 1 millimeter thick. So its thickness is about 1 millimeter. Okay, thickness. Okay, this is the thickness of a SA node. Another thing regarding the SA node is that it has no contractile muscle filament. Okay, no contractile muscle filaments, or it has no contractile muscle filament. Okay, so it has no ability to contract, and its contractile muscle filament, their muscle fiber has a diameter of about 3 to 5 micrometer. Muscle fibers that are present in SA node has a diameter of about 3 to 5 micrometer. 3 to 5 micrometer. As we know that the muscle fiber diameter of atria is about 5 to 15 micrometer. Okay, which is greater than this. So I'm not starting here. Okay, so this is the diameter of muscle fiber of a SA node, which is as small as compared to atrial muscle fiber diameter. Now, what is mechanism of SA node rhythmicity? How rhythmic excitation occur in this SA node? So first of all, it is important to know that resting a membrane potential of SA node is about minus 55 to minus 60 millivolt, which is very positive as compared to minus 65 minus 85 to minus 90 millivolt is of that of a ventricular muscle. Okay, so this is relatively more positive as in resting condition as compared to ventricular muscle. So what is the cause of it less negativity? Okay, it is relatively positive. So what is the reason? They are less rigid because their membranes are not permeable to sodium and calcium. Okay, so their sodium and calcium leakage occur as a result of sodium move inside the cell. As a result, it become more positive. So their membrane is impermeable to sodium ion and calcium ion. Okay, so what happened actually? Sodium and calcium ion move inside the cell. This is SA node cell. Sodium ion will move inside the cell. Similarly, calcium ion too. So what will actually happen? That it resting state will become minus 60 or minus 55 millivolt. So okay. So actually, what happened here? I am going to explain how SA node is excited. Okay. So in normal condition, the sodium ion move inside the cell. This is cell of SA node, SA nodal cell. ये क्या है? SA nodal cell है, या जो मसल है इनको आमतौर पर क्या कहते हैं? फाइबर कहते हैं. So SA nodal fiber. This is SA nodal fiber. In normal condition, resting membrane potential. So actually, it is impermeable. It is permeable. I'm writing here permeable. It is permeable. That means that ion can pass through it. Sodium ion can pass through it, and sodium ion move inside the cell. So actually, its potential is not minus 85 and not minus 90, but it is minus 60 millivolt. Okay, so it is resting membrane potential is approximately, here I'm writing minus 60 millivolt. Okay, so sodium is coming in, and it potential increasing, moving toward positive, and it become minus 40, which is called threshold potential for this SA node. Okay, now calcium gates open. These are calcium gates. Okay, and calcium concentration, as we know that, is more outside the cell as compared to inside the cell. Okay, So actually calcium ion move inside the cell. As a result, the potential rises to upward level T, okay, and it become bit positive. After this, calcium gates closes and potassium gates opens. Now note that concentration of potassium ion inside the cell is high, but concentration of potassium ion outside the cell is low. So motion of potassium ion takes place from inside of the cell to the outside of the cell. So the inside of the cell become more negative and outside become positive, mean that again this occur to come into the resting condition is first. So actually this is repolarization, which is due to the outside motion of the potassium ion. Here the potassium ion continuously move outside and it cause a hypopolarization, which mean that very low polarization, mean that the very negative, that minus 60 millivolt occur. So this is this graph. It actually represent depolarization and this represent a repolarization. So the difference between ventricular depolarization or repolarization and SA node repolarization and depolarization is that depolarization of ventricular and the action potential which spread to the different cells to cell of a ventricle is that of entrance of sodium ion, but depolarization and especially depolarization in SA node occur due to the entrance of calcium ion. So it depend upon SA node, depend upon calcium ion. Okay, now here next we know that this is left SA node cell and it is attached to the atrial cell. So calcium ion also move into the atrial cell and cause their repolarization and depolarization and then occur repolarization. So this is SA node cell and this is atrial fiber, yeah, atrial cell. Calcium ion here occur and here depolarization and repolarization occur, and then depolarization and repolarization impulse move from cell to cell. This is a bit different. We already discussed this process, but with respect to ventricular repolarization, here is only a simple difference that its action potential is resting event potential is minus 60 to minus 55, and that is another difference. There is that it is here the entrance of calcium ion taken place in S compared to that of sodium, where in ventricle sodium ion come inside, but in SA node fiber calcium ion move inside. So this is self excitation of SA node fiber. Okay.